Hi guys, hey. Oh, this case, it's finally over. I did it, guys. I can't bloody believe it, honestly. I won, and Brighton Council have agreed that my medical cannabis expenditure will be accepted as disability-related expenditure, aka DRE, and that means that they have reduced my care charges down to zero, nil point. I don't have to pay any more care charges because I pay for medical cannabis. And they're also going to refund me as well, almost a year's worth of care charges. So it's a massive result. It fell at the last hurdle. It was the last bit that was the most stressful. The day I got the letter from my named GP who wrote that opiates are completely safe for me and medical cannabis should never be taken every day, that was the day that I had a mental breakdown over this case. I really, really did. Because just to recap, I had already won my ombudsman case, and the council had given me the same person that had originally discriminated against me, Angela Emerson, to reassess me. And instead of taking the medical evidence that the ombudsman had already provided, that she was still insisting on asking, am I a recreational user, basically, and is this a choice? And then it was just an absolute hiccup because I thought that she had breached GDPR because she had somehow managed to get hold of my named GP, who is the GP that I did not consent to her contacting. And that named GP wrote a load of inaccurate evidence about medical cannabis. But basically, it was meant to go to the doctor that has overseen my opiate withdrawal. But he was on holiday, so it went to my default GP. And even though he knows nothing about cannabis, he decided that it would be a brilliant idea to write this report on behalf of the GP who it should have come from. So this is what he wrote. I understand that you are upset about the report, particularly because I was not fully aware of the background of your treatment with medically prescribed cannabis. This was partly due to the fact that you were consulting the doctor who is more familiar with your case than I am. I only prepared the report because the doctor was on annual leave at the time. Unfortunately, this meant that I did not have the first-hand knowledge of your treatment plan and cannabis prescription that he would have been able to provide. In the report, I was very clear about my lack of knowledge and experience with medically prescribed cannabis, and I made it really known that this limited my ability to fully assess the treatment plan in the way I would have preferred. I apologise for not being more aware of this important context. No shit, says Sherlock. And I understand how this may have led to upset. I mean, it wasn't upset. It was a full mental breakdown. It really was. I wouldn't call it upset. I lost my mind that day when I got that letter. And then he says, my intention was never to cause any distress, but rather to provide you with a report based on the information I had available at that time. Following a discussion with you, the doctor has since rewritten the report, taking into account the full context of your treatment plan. I'm happy to endorse this updated version of the report, which more accurately reflects your care and circumstance. And then he went on to, that was the formal complaint apology to me, and then he went on to write this to Angela Emerson. As you may recall, I previously wrote to you regarding Sky's prescribed cannabis. In hindsight, I realised that this letter would have been more appropriately addressed to the doctor who has been closely involved in managing her long-term cannabis treatment, as well as her opiate reduction and pregabalin prescription. I mean, my GP is not managing my long-term cannabis treatment, but he did manage my opiate reduction, and he does support my case. So, and then he goes on to say, additionally, I was unaware of the existence of the medical letters you mentioned, which has contributed in some confusion on my part. I think he is referring to the fact that I had a bowel perforation because of opiates. And then he put, I've since issued an official apology to Sky, acknowledging that I did not have the complete background information or a full understanding of the reasons for her initial prescription of medical cannabis. In light of this, I would kindly request that you remove my initial letter from your records, that the doctor has kindly agreed to rewrite my letter, which I now believe comprehensively addresses all of your concerns. So that was what was written to try and counteract the damage that was done by this GP. I mean, I don't understand what possessed him to think that writing a report about medical cannabis when he knows absolutely nothing about it, and also writing a report about me when he knows nothing about me and my bowel condition, was a good idea in his eyes. Honestly, these doctors are so out of touch with what patients really need, and it really did cause me a very serious mental health crisis when I received that letter, because I just couldn't believe that he could write something so inaccurate with such conviction that he knew what he was talking about. But anyway, so that was what he wrote. And then this is what I got back from Angela Emerson. In the light of this further correspondence, I have carefully considered all the information provided and have taken further account of your individual specific medical circumstances. The medical information we had previously was conflicting, and we now have clarity from your GP about your personal situation relating to the specific risk of bowel perforation associated with opioids. It's now clarified that there can be no exception for the NHS to fund medical cannabis for your specific health conditions, even though you have significant pain due to previous and current bowel issues. It has also been clarified that you previously took naloxone as an alternative but could not tolerate this drug. It is therefore agreed, drumroll, that the outcome for the financial assessment review is that an additional DRE allowance will be included in the assessment for medical cannabis, yes. Alongside the other DRE allowances which are already included in the assessment, there will be a further allowance of £62.03 a week. The maximum weekly income disregard for DRE is equal to the income received from PIP, care component payments. This additional DRE allowance will bring the assessed charges down to nil and will apply from the day that you originally requested this expenditure to be included. So it is over. It's done and dusted. I won my case. Finally, Brighton Council have agreed that the Ombudsman recommendations were correct. So that is that. I've got no more care charges to pay, and this case is over. I don't ever want to do a fight like that again. It was a bloody fight. It was a bloody battle. Honestly, I felt like they ripped me up in the boxing ring and I staggered away with a broken nose and a few cracked ribs. And I'm just absolutely elated that this case is over, because it's taken up a whole year of my mental health and my spoons, my energy. Patients should not have to fight this hard, tooth and nail. And the other thing I want to say is a massive thank you to the Redditor that wrote me stonking email to send to Brighton Council legal team. I honestly don't think I would have won this case if it hadn't been for you. And you know who you are. And honestly, I'm so grateful from the bottom of my heart, because I'm not the best at writing. I could never have written anything like that in a million years. So thank you so much. I'm just so glad I did that last video about this case. I'm just so glad, because I was just praying that someone would help, and they did. I just love our community so much. I really do. You know, we're all here to help each other, and I'm really hoping that my case will help other people. I'm hoping to co-write a document for this so that other patients can access it easily if they get social care, because at the moment it is quite rare, because not that many patients get social care. But obviously, as more patients come on to UK medical, there's going to be more patients that do receive social care. And yeah, I really do hope that my case will help other patients. So if anyone is trying to get social care, or if anybody already has social care and wants to get their care charges down by getting medical cannabis accepted as disability-related expenditure, just get in touch. I'm not brilliant at writing complaints, but I can support you through the process and guide you in the right direction. So let's do this together. You know, let's make some change. Let's help patients and, you know, help people not to have to fight as hard as I fought for this first case from the Ombudsman about medical cannabis. It's brilliant news, and I'm really, really happy to put this case to bed and think about something else for a while. So yeah, take care everyone, and I will speak to you all soon.